Assalamualaikum warahmatullahi wabarakatuh. We will present about our group report for assignment proposal systems. Our system's name is Healthcare Manager. We go to introduction first. Healthcare Manager system is designed to help healthcare providers more effectively capture, store, retrieve and share patient health data and allow better patient care. It manages the smooth performance of healthcare along with exercise, healthy food suggestion, mass reminder, diet guides, fitness activity, COVID-19 and obesity information, and provides customer services. Security is one of the key criteria of the clinic management system. All medical records must be secure and available only to approved users. In order to protect sensitive data, simple and detailed interface should fit their roles and responsibilities. The development of software for the Healthcare Manager framework is a tremendously opportunity to create a distinct, effective, and quick model of healthcare delivery. This Healthcare Manager system can also help users to know more updates about COVID-19 like symptoms, news, etc. So, next we move to the problem statement. There are 5 problem statements. Firstly, access and quality of healthcare. There is ample evidence of the obstacle faced by people with disability to healthcare and quality treatment. In general, intervention addressing health and quality inequalities among people with disabilities fall short of environmental and contextual variable and make unrealistic assumptions about equality in terms of structural mobility, access to services and cultural sensitivity. Secondly, difficult to get a doctor's appointment. When the number of patients grows dramatically, the doctor operates on a tight schedule. So, the healthcare system is forced to give priority to emergency cases. Suppose you need any emergency surgery, so the hospital will make plans immediately. The problem is that you will have to wait months for any other conditions, such as back pain or hip replacement. Thirdly, taken for granted. Another concern is that individuals avoid prioritizing their health. Preventive interventions are avoided solely because people have to access to basic health care. There are less people who can stay healthy and adopt a healthier diet. Fourthly, requires time to adapt fast. As we know, technology continually changing. There will be a new software, new updates, new ways of doing things for a long time. To keep up with the competitive edge, hospital workers must keep up with these shifts. So, for some, in particularly for the older workers, this can be a challenge. Lastly, susceptibility to network hackers. For ethical and legal purposes, the medical records and other health details of patients should be kept private. Although the network of the healthcare system is certainly fitted with security measures, network hacking is not impossible.
So I will continue with the objective of the project. There are 3 objectives for this project. First, to provide an effective system that will track, trace, and monitor users' health. The system that we will create can provide useful information for user and fitness activities to track weight. Next, to make the service more responsible and sensitive to the need of community. This system also provides many features for the user such as calendar reminder, healthy food suggestion, and so on. The last objective is to provide optimal support and comprehensible primary health care to the community. This system also provides reminder to remind the user if they have appointment with doctor. Besides, we also provide customer service. We move to the existing system related to the project. There are several systems that related to the project, which is to monitor health status and solve community health problems. These existing healthcare only focus on human personal needs. A health system, also sometimes referred as healthcare system, is the organization of people, institutions, and resources that deliver healthcare services to meet the health needs of target population. The second one is fitness tracker. Fitness tracker or fitness wearable has become trendy product. Wearable are small bracelet-sized electronics that use as pedometer to count step and blood pressure. It also used for counting calories, timing exercise, getting weather, and set as reminder. Choosing a fitness product can be challenging because almost of them offer the same service and the cost is quite expensive. By using our system, users can stay fitness because it also used to track body weight and a reminder to work out.
Okay, hi, my name is Zuraini binti Rosli, and now I will present the suggestion for the improvement of the system. So I got 3 points here. The first point is to include the search feature in the system. So search feature help user to find the information they need very quick. It help user to ask specific question and get the specific answer. In today's technology, search feature have moved from the traditional desktop to the smartphone and other applications that we use in daily life. There are uh, there are a few search features that can be considered to include in the system in order to enhance the user experience. First, by using the personalization or predictive recommendation. This search feature relies on log analytics and big data processing to show the most suitable answer based on past data about user click activities, search queries, also their location and device. It is important to provide the answer fast and quick with accurate answer to maintaining the high user satisfaction when using the system. Okay, second, search feature by using relevancy ranking. As the data grow, the difficulty to ensure the best match result may appear. However, this can be handled if we improve the data tagging, site search performance access, and tweaking the relevancy algorithm. It is also important to make sure that the demand of data access can be done anywhere and can be shown on small screen size. Okay, lastly, the search feature by using the query completion or autocomplete. This feature help user by providing the list of possible suggestion when they are typing into the search box. The suggestions are based on popular search queries or high value queries. So the second point is to keep the system design simple. Too much design and unnecessary pop out in the application may distract user from finding what they actually want. Okay, so the third point is to improve the consistency in the application. Keeping the consistency in the user interface is important to gain the loyalty of the user. It is to assure user that they are on the right path with the logo and trademark design on the application. Okay, so now let's move to the impact of the project system. Okay, so today's technology allows people to access information and data they want at any time and anywhere. Help manage application offer user to track their body health condition in so many ways. The system allow user to track their workout or exercise, provide healthy food suggestion and recipe, diet guides also provide the latest information about the COVID-19 pandemic. There are so many benefits of using the healthcare manager. And so one of the benefit is it is accessible when hospital and healthcare worker are struggling to save life with the COVID-19 pandemic. We can practicing social distancing by not going to the hospital to check our health condition. This is because in the healthcare manager application, user can directly give a doctor the information about their health, so doctor can easily track their health through the system on the application. So the second benefit using the healthcare manager is it can help to reduce costs. Okay, for example, when the patient visit the clinic just to check their current health condition, it will cost them a lot of money to pay to the doctor and for the consultation. But by using the mobile application, they only need to subscribe once in a lifetime. Okay, so next, the benefit of healthcare manager application, it is enable more access, especially in the rural area with limited healthcare facility. Okay, so this app monitoring the patient health condition, and if there any prescription need, they can scheduling a video call with the doctor without having to go to the hospital, which might take several hours to arrive. So now let's talk about the disadvantages of using the mobile application to track health condition. So the first one is the application often require a strong internet connection to open or to use. Normally, people in the rural area will facing this problem because they have a broadband gap compared to the urban area. The application will not functioning well if they have weak internet connection. They might also lose some of the important some of the important information, and bugs will come in when the unstable internet connection appear. Okay, so other than that, data privacy and security also need to be concerned. When using the application, users need to put in their personal data to register and to subscribe to the application. If the smartphone or device they use to register was stolen, the information about their personal data can be easily accessed, manipulated, and used by an unauthorized user. Okay, so next, the application is not accessible to everyone because not everyone own a smartphone to download the application, especially children and the elderly. They still need to go to the hospital or clinic to check their health condition. This will risk the infection of the coronavirus during this pandemic. It also can be a problem when the application or the updated version of the application may not run in an older phone because the application require the latest technology to be used.
Next, I will explain our group project progress about estimated budget and cost required for our healthcare manager system. Careful consideration should be given to the production of our system healthcare manager. Budget and cost needed to complete the project. Estimated budget and expenses. It is very necessary to ensure that all problems relating to cost and the budget are well prepared. It is very important to ensure that the healthcare manager can be booked without pricing the cost. Mm, our system healthcare manager is concerned and it did not require a large budget and expenses as the cost could be reduced due to the certain software that we use is free. For example, like Laragon and Subline Test. There are no costs needed. However, some software and hardware still needs to be purchased to build our healthcare manager system. As example, like laptop that we use and software like Windows 10 Professional. So below is a table of the project budget and the cost required for healthcare manager system. So we use three kind of hardware to um, create healthcare manager system. Uh, First hardware is laptop. We use one laptop model as a Aspire E15, and the price is around RM 1,600 ringgit. And one more, we use one laptop model HP Notebook 15, and the price is around RM 1,998 ringgit. Second hardware that we use is mouse. We use one mouse model HP M2880 optical gaming mouse, and the price is around RM 47 ringgit. And the last hardware that we use is keyboard. We use keyboard model Logitech MK470 slim compact and quiet wireless keyboard, black color, and the price is around 179 ringgit. Next, we use 7 kind of software to create healthcare manager system. First software that we use is Laragon software, and it is totally free. Second software that we use is PHP MyAdmin version 4.7, and it is free too. Third software that we use is MySQL Server version 5.5.29, and it's totally free too. Fourth software that we use is SAM Server version 7.4.1, and it's totally free too. And fifth software that we use is Sublime Text 3.2, and it's totally free too. Sixth software that we use is Google Chrome browser, and it's free too. And the last software that we use is Windows 10 Professional, and the price is around RM 610 ringgit. Next, I will explain about hardware and software, more details that use in this project. We use first is hardware, and we use 4 kind of hardware. Which is first is Acer Aspire E15, second is HP Notebook 15, third is mouse model HP M280 optical gaming mouse, and the last one is Logitech MK470 slim keyboard. All of this hardware is very good and power that help our works very smooth to create this healthcare management system. Next, there are 7 kind of important software that our group use to create healthcare management system. First software that we use is Laragon. Laragon is portable, isolated, fast, and powerful universal development environment for PHP, Node.js, Python, Java, and etc. It is fast, lightweight, easy to use, and easy to extend. This software is great for building and managing modern web application. It is focused on performance designed around stability, simplicity, flexibility, and freedom. It is very lightweight and will stay as lean as possible. Second software that we use is PHP MyAdmin. PHP MyAdmin is a free software tool written in PHP that is intended to handle the administration of a MySQL or Maria database server. We use PHP MyAdmin to perform most administration tasks, including creating a database, running queries, and adding user accounts. That software that we use is MySQL Server. MySQL is a relational database management system based on structured query language. The software is the most common standardized language used to access database. MySQL server can run comfortably on our desktop um, or laptop alongside our other application, web server, and so on, requiring little or no attention. Fourth software that we use is XAMPP server. XAMPP server provides two essential components for its installation. Apache, which is used to create the local server, and MySQL, which we can use as a database for our website. XAMPP's server designer intended it for use only as a development tool to allow website designer and programmer to test their work on their own computer without any access to the internet. These software are used to access data from the database and testing the website by using the PHP language before we publish our system in the real public web server. The Hacker Manager system are using this server during the process in developing in order to testing the system. This software that we use is Sublime Text. Sublime Text is a shareware cross-platform source code editor with a Python application programming interface API. It natively supports many programming language and markup language, and function can be added by user with plugins and typically community built. Uh, Sixth software that we use is Google Chrome browser. Google Chrome is one of the most common browsers that users frequently use. Google Chrome browser is open and everyone can use it. Google Chrome is used by the user to access and search the World Wide Web for information. So our Hacker Manager system use the XAMPP server as a portal to view the system on a web server. Lastly, the software that we use is Windows 10 Professional. Windows 10 Professional is an operating system that is installed in our laptop to develop this system. The Pro Edition of Windows 10 offer features like sophisticated connectivity and privacy tools such as domain join, group policy management, BitLocker, Enterprise Mode, Internet Explorer, EMIE. Windows 10 Professional help our groups very powerful to create this Hacker Manager system.